advertise first, the Cancer Society has a very excellent information package on bowel cancer and a booklet within it on bowel cancer, which is written in nice, easy to understand and can guide you to more in-depth stuff if you need it. So these are good publications. So just a few punchlines, really. If you're not sure if something's wrong with your body, when in doubt, check it out. If things aren't as they should be. Now, we've mentioned, blood is supposed to stay in your body. It's not supposed to leak out, with the exception of the ladies in every month, perhaps. But if you're leaking blood, it's not normal. Get it looked at. An altered bowel that's persistent is not normal. We'll exclude after 6 beers in the Vindaloo. But if things are chopping and changing for no good reason, get it checked out. Now, are there any GPs in the audience? Are there any GPs, general practitioners in the audience? Because I might upset them if what I'm going to say. Because if you go to your GP complaining about something you're worried about, the first thing is get to the point. Focus on what's worrying you. Don't start talking about your ingrowing toenail and as an afterthought say, oh, and by the way, I've been bleeding a bit. Go for the main event and get that as the focus. And if the GP says, right, we'll give you this hemorrhoid cream, we'll see you in 6 months, you could always drop in, well, why have you not examined me? Because one of the surveys you did found that if people referred or who were found to have bowel cancer, only 1 in 10 had actually been examined by their GP. And if you don't get an examination, then you can't say that there's nothing to worry about. But be prepared to be examined. And that's the other thing. Don't say, all right, well, I better get you up on the couch and take your gear off, and then you run away. You've got to be examined to find something. So, things to ask your oncologist, and at the risk of, none of my colleagues are here, so I can say this. Are you a specialist in this? Or your surgeon, for that matter. And then key questions about treatments. Will it make me feel better? Will it make me live longer? And if the answer to both of those questions is no, then why am I doing it? Why are you doing it? Do I have to have it? I've started, I don't like it, can I stop? And I meet many, many people who carry on having treatments that are upsetting them and not apparently doing them any good, who keep going because it would upset their doctor if they stopped. Forget your doctor's feelings, it's about you. So, discuss it. But it's not a contract in blood that having started radiotherapy, having started chemotherapy, you have to have it to the end if it's not doing what it's supposed to and helping you. You want to comment on that, Chris? Other questions are, how long will it take to recover? And my answer to most of those things is, you may recover, but things will never be the same. You can't cure cancer, you can't treat cancer without consequences. And that's the bottom line. We strive to do you good without doing you in. So my final weapon, if you don't feel that you're getting the attention and you've been listened to enough by your GP, they've said something, they've done something, they've sent you on the way to come back in 6 weeks, 3 months, whatever. You just drop in, do you think it could be cancer, doctor? And they might change their approach. And that was all I had to say.